Hey everybody, Kevin here from ChangeWorks Interactive. Welcome back. Today I have a guest that is very near and dear to my heart. She's actually my wife. We're lucky to have Dr. Rosemary van Straalen on the show today, and we're going to talk today about a lot of different issues and a lot of things that that Rosemary has seen in her practice over the course of 30 plus years, 25 of which have been served in Oakville at Trafalgar Medical. Now, I got to tell you, Rose is a pet lover. She's a golf enthusiast. She is a travel enthusiast. Welcome, Rose, to the show.
Oh, thank you for having me.
Good. First question I want to ask you is just about your practice, just about the practice itself. And, you know, maybe that's changed over the years. And I know you want to talk a lot about women's health today, but give our listeners a little bit of a sense of what your practice is all about. Maybe some of the things that you see frequently in your practice.
Sure. I think for our purposes, because of what you do as a psychotherapist and what I see, I'll probably focus more on mental health.
Yep.
And sort of what I've seen over 30 years. So that certainly 30 years ago, mental health was a very small part of the practice.
Yeah.
So pretty much depression, some anxiety. There was sort of better access to psychiatry. People, if they were bipolar, schizophrenic, had more significant mental health issues, were often linked to someone and had that person that would follow them. And we would kind of be a bystander in some respects. I think what we've seen over the 30 years is a bit of a tsunami of mental health issues that continue to increase. I think the pandemic really heightened that even further.
Absolutely, yeah.
And still, definitely seeing a lot of depression and anxiety, seeing a lot more sort of ADHD, eating disorders, other types of disordered eating that makes for a much more complicated family practice.
That's interesting you say that about, about all those conditions that you see coming through the practice. Like, do you think that in some ways there's an overdiagnosis of, some of these issues that come up? Like you read social media and you see things about ADHD, for example. Mm-hmm. Do you think it's overdiagnosed? Do you think it's like, it's too much? It's too much. Everyone has OCD, ADHD, anxiety, that it's just too overwhelming. Everybody thinks that they have something.
I definitely think, social media, the internet itself allows people to sort of look up diagnostic criteria and what do I need to have, what boxes do I need to have to tick to get diagnosis X or Y. I think podcasts, maybe not necessarily yours, but some podcasts, TikTok, definitely talk a lot about sort of ADHD. Mm-hmm. And, I think people hear this and think, I think that's me. I think I'm going to go see my doctor and get assessed. And don't realize that, ADHD is complicated, and that is complicated to diagnose. It's not something that we can do in a 15-minute doctor's appointments, or at least do well. Mm-hmm. I do think that there's almost kind of not an expectation, but this phenomenon where everybody wants to have something. Everybody wants to have a label, and I think there is too much emphasis on that. Mm-hmm. In sort of younger populations. And maybe the focus more has to be on what symptoms do you have, and how are those impacting your life in terms of your work, your social life, your relationships. And maybe we can talk more about that as opposed to have a label, have a drug, have a solution.
Rose, when somebody is getting a diagnosis, for example, of ADHD, like what's involved with that? Is there tell us maybe how you walk through that, and would you be more comfortable like even referring something like that out?
Oh, that's a great question.
Once in a while I'll ask good questions.
Yeah. I mean, it would be awesome if everybody could see a psychiatrist, get a formal assessment where there's objective tests that are sort of computer-based, that are verified, that kind of give you a really objective view of, does this person have ADHD? ADHD, is it mild, moderate, severe? And then that can help guide therapy. But it's not realistic. Psych ed assessments would be wonderful as well if everyone could get that done. But those will range $2,000 to $3,000.
Right.
For people. And even now, like in Halton, if I try to refer to our psychiatry group and say, I think this person has ADHD, the referral gets declined. They will not do those assessments.
So what happens then to that client if it gets declined?
It's my responsibility.
It becomes your responsibility.
Yeah. So this is what happens. So I think, I'm not saying ADHD isn't real and that people aren't suffering. I think there's obviously a lot more awareness, and maybe that's why we see so much more of it. Maybe other people, like I can think of people I went to school with now that for sure had ADHD and suffered and didn't get the education and the help that they needed. There was no IEP, there was no help.
Right.
And that's unfortunate. So I'm not saying what's happening now is wrong, but it does, for us, require not just a simple one-page ADHD checklist where I check all these boxes, so give me my prescription. It needs to be more about, tell me about what your elementary school was like. Because ADHD is from birth. Like, this doesn't just happen when I'm 20 and I can't get through university. This has always been there. Yeah. So where's the evidence for that? So are there old report cards? Have your spouse come in for an appointment? Have you had performance appraisals from work? What do they comment on? What are they saying? What did coaches have to say about you? Mm-hmm. So this isn't a one-and-done appointment. I know that they've done piles of reading. They're coming in, guns blaring. I want this. I need this. This is going to take a few appointments. So I think just work together with us. Know that, I'm not the most qualified person, but I'm the only one that's going to see you. Mm-hmm. So let's try to work on this together. But I need a good picture. I need a good story to make me feel comfortable to write a prescription for a drug that has side effects, that can increase your heart rate, can increase your blood pressure. It has a street value at the university campuses. I want to feel good about what I'm prescribing.
Right, and I think the point about, don't we all want that, where there's multiple sources of data that we can draw upon to make an informed decision on something, right?
Yeah.
I want to ask you something, Rose, about your own life and just, how you manage in a way, because listen, I see the stress and strains that you are under as a family doctor, and I know it's a lot. And half jokingly referred to that sometimes as being the hamster or the rat on the treadmill, because it's go all the time, and that yesterday looks like today, looks like tomorrow.
Yeah.
What do you do that keeps you healthy, keeps you operating? And, maybe that's good advice for anyone that works in healthcare, whether it's something like I do as a psychotherapist, whether it's the nurse, like our daughter, whether it's somebody that's working as a paramedic, where it's somebody that's on a front line somewhere providing medical service. What do you do that's helpful that keeps your batteries charged?
I think the biggest things are going to be exercise. I think that is huge. And not just like I took my dog for a walk, like sweating, you can't talk to somebody because you're working to breathe type of thing. So I think really fairly intense exercise, and whether that's cardio, some weightlifting, trying, like, it's all those motherhood statements, right? It's like eating good food, treating your body well, like getting good sleep, limiting your alcohol, don't smoke. I think I'm lucky where I'm at, particularly now. So I've been there for 25 years, so a number of docs have retired. So when I started at this clinic, there was 2 women and 9 men.
Yeah.
I think there's like 3 men and however many women.
Yeah.
So I now have a community of women that I go to lunch with almost every day of the week.
No, I know. That's awesome. It's amazing.
That you commiserate with, and you share stories with, and you share problems with. So I think it's having a community, having kind of a work family that is supportive. I have a supportive husband. your pets, your sports, the other things that you do that give you an opportunity to blow off steam, but also just to feel good.
Yeah.
And I think really when it comes to mental health, exercise is probably the biggest. I think people are always looking for pills because it's easy, but I don't think it's really a long-term solution.
It kind of sounds like a combination of both. Like there's people that
do need both.
Yeah. That there's people that need medication, but it's also all these lifestyle choices that we can make, right? Yeah, very good, very good. I know you wanted to talk today about women's health and the importance that has in your practice and how you connect with women and empower women that are in your practice. What are some things that you run across frequently in terms of women's health that are important to women that we could all understand?
That's another good question. I think probably because of where I'm at in my career, my practice has kind of grown with me. So as I've become menopausal, so are they. And I think there's a close link between sort of women's hormones and mood. So that whether that's people that have PMS around their periods, so that their hormones drop, they have their period. So when that drop happens, their moods may not be great. After a woman has a baby. So again, full of hormones, drops, then again can have some depression, anxiety and such at that time in their life. And then again, obviously with menopause, where it's more permanent. And we know that estrogen's linked to serotonin, which is a very important transmitter in our brain for depression and anxiety. So it increases the production of it, the amount that's floating in our brain, how it works on our nerves and neurons. So when that estrogen drops, there are physical chemical effects. And I think when I first started practice, so again, this is early 90s, we were putting everybody on hormone replacement therapy. It was like, oh, you're in menopause? Okay, here you go.
Yeah.
And then early 2000s, there was a study that came out that said, okay, we studied this massive group, 64,000 women, and we were seeing more heart attacks, more strokes, more breast cancer. So we had to take everybody off hormone replacement, which was heart-wrenching. So here you felt, I sold you a false bill of goods. Now I have to retract all of these things I've said, wean everybody off. They're miserable because now they're off their hormone replacement. And then for almost a decade, these women going through menopause had no help. And it's not that every menopausal woman needs hormones, but it's nice that now, again, in these last couple of years, and I'm sure for, it's not just kids that are watching social media. All the women are too. So they're all running in going, get me on the hormones. I want to be on the hormones. So same thing, they've read all this stuff. They've seen all these influencers on social media. So now they want to be on hormone replacement. So
Rose, do you think, sort of jump in there, but do you think that it's part of this is also the psychological support? Like that a woman could say comfortably that I talked to my doctor about this. She gets it. She understands me. She knows what I'm going through. Maybe she's been around the block. She's experienced this as well. Is that part of this as well?
Oh, I think so. I think people feel that, well, I'll make a point of asking how people are doing, at a checkup or whatever, how are things going with this? And I don't know them. I think my patients can see my degree and can probably figure out my age, but can probably guess where I'm at.
Well, I remember when you started practicing and you looked really young, and particularly men would say, "Come on, you're not my doctor.
Yeah.
Come on, you're not old enough."
Yeah, I had a lot of that. So, I do think lived experience goes a long way, and you can say this helped me. It may not help you. It can help with the brain fog. It can help with depression because about 40% of menopausal women can feel some depression. Okay. Can help with the hot flashes, the not being able to sleep. It's not the fountain of youth. You're still going to be wrinkled and you're still going to gain weight and lose muscle mass. Like those things are still going to happen, but it is definitely a tool that you can now safely, again, offer that we didn't for a long time. And it improves bone health. It lowers your colon cancer risk. So again, it's just another tool. I think maybe for men, it's good to know that after a baby, when women are going through menopause, those are really vulnerable times for women. And I think menopause in particular, because those other states, your hormones are going to come back. But with menopause, this is forever. This is your new normal. Your role as somebody who can bear children is gone. So what is your purpose? Mm-hmm. At the same time, your kids are leaving for school. So then that day-to-day momness isn't there for you anymore either.
Yeah.
And then you have aging parents. And that often, again, falls to the women. Mm-hmm. Just to sort of be aware of that, be patient, be understanding.
Rose, thanks so much for joining me on this show. You've seen me kind of doing my thing for the last several years, and I always appreciated your support. And this is just another example of that. Talking to us about women's health, talking to us about mental health, talking to us about things that you're seeing in your practice and how that's evolved. So thank you very much for doing that. So everybody, we've been talking to Dr. Rose van Straalen. She's been a physician for the last, kind of pushing 30 years. We've also just celebrated our 30th anniversary being married, and you'd probably say, Rose, that every year was not perfect, but that's the way relationships are.
Yeah.
And we're happy to say that we are together. So anyways, thanks for joining us again. And thanks for tuning in to ChangeWorks Interactive. We'll talk to you soon.